Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Thank you very much for having me on the program.
Yes, sir. Before I get to some vaccination questions, I wanted to ask you, can you provide an update on the total number of imported cases thus far, if we have any at all?
Well, so far we have about 48 cases that were imported. But these cases, as you would realize, were detected as soon as they came in. Most of them we have detected at the two airports, the two international airports. That's the Jagan International Airport and the Eugene Correa Airport at Ogle. So we have, because of the protocols that we have, if someone exceeding 3 days, we do the retesting here, and actually when we did those retests, we have found that those persons were positive, and we have taken the relevant steps to isolate them. So since the reopening of the airports to international travel, we have detected 48 cases.
All right, and I just wanted to talk about Suriname, because when we opened there as well, I know that facilities have been set up for when persons come across as well.
Well, Suriname, that crossing so far, we haven't detected any because there's strict protocols on both sides. So if you're going over from Guyana, you require a PCR test, and then the Surinamese authority also would quarantine people. And coming back this way, you also require PCR testing. So I think so far, because of the way that we've been testing and allowing passengers, we haven't found any positive, and that's reassuring, I guess, to both countries.
Okay, sir. On a matter of international travel, once a person is fully vaccinated, can he or she travel just like before we had COVID? And just to follow up, for citizens who are fully vaccinated, will they be required to produce a negative PCR test coming to Guyana?
So the first question, whether someone who would have been fully vaccinated would be allowed to travel without a test, the answer is no. And that is that you are required to continue doing your PCR testing or antigen testing as is required by the country that you're going to. The reason for that is that while the vaccines would help to reduce the severity of COVID-19 disease, it does not stop COVID-19 infection. So all the vaccines that are currently on the market, there's still a chance or a possibility that you can get infected. However, if you're infected and you've been fully immunized, then you will get a less severe form of the disease. So that is why people would, countries would continue to do testing to ensure that, people who are positive are not traveling because they can carry the disease. Your second question was?
You basically answered the second one in that, so thank you. We have two frequently asked questions, and one is, will the COVID vaccine make someone test positive?
No. Again, the way that we do PCR testing, it does not, if you get a vaccine, vaccines work by stimulating the immune system to respond to the virus. So, and the antibodies that you will have in your body would not allow you to test positive once you're using a PCR or an antigen test.
All right, and they follow up to that. This is actually a follow up to one of the first questions. If I get vaccinated, do I still need to do a COVID test if I have symptoms?
Yes, because if you, although you are vaccinated, and which comes back to the first question or the second question that you asked, you can get vaccinated or be fully vaccinated, meaning that you've gotten 2 doses. However, because of that window that is there, since it would reduce the severity of the COVID-19 disease, but it still does not, 100% prevent the infection from happening. There's still that possibility that you can get infected. So if you have signs or symptoms that, resembles COVID, then you should be tested. And if you get a test and you test positive, well, then you follow the same protocol.
Okay, Minister. I wanted to find out roughly how many persons have been vaccinated thus far in the country.
As of yesterday, we would have completed about 32,714, I think it was. I think we'll do far more today because I see a lot of the centers now, there are lots of people coming out.
All right. And have we completed the vaccination of frontline workers and those persons 60 years and older?
Well, we had a specific time period for persons 60 years and over and for frontline healthcare workers. Now, we wanted to give preference to these 2 groups. We have not exhausted the 2 groups. There are still persons from that age group or some of the health workers who have not come forward as yet. And therefore, as we drop the age, it does not exclude. So right now, as we are at 40 years and above, right, and I want people to pay close attention to that, because I've received reports that people are coming to the center, and if you're, say, 60 or you're 80, I've had a few reports where they're being turned back. The thing is, if you are 40 years and above, so whether you're 60, 70, 80, 90, whatever it is, once you're above 40, then it's okay for you to come and get your vaccine. So that whatever that, so when somebody is, say, 70 or 60 turn up, you can't turn them away. You should be able to give them their vaccine. I think that is important for people to understand.
All right, thank you for that clarification. We've actually gotten reports of a few cases. And I also wanted to ask you, in terms of the other categories of frontline workers, the media, teachers, servicemen and women, and so on, any idea when that may start?
Well, we're right now prioritizing a few groups. So I guess after the Easter holiday, we'll start doing some of those types of prioritization.
All right. It might be a little too soon to ask, but I still want to ask, in terms of herd immunity, us reaching there, not a time frame, but when is it likely that we will perhaps be approaching that?
It depends on a number of things. One, the types of vaccines that we have and that we're using. So the more efficacious vaccines can reduce the number of people required for you to get herd immunity. So that's one thing that we have to look at. Secondly, is how fast we're able to roll out our vaccination program so that we can get more people covered with vaccines. A lot of the experts believe that we need to get maybe about 70 to 80% of the adult population covered. So we're still some way from that. But once we start doing that, we'll be able to reduce the circulation of the virus in Guyana. And then, in addition to that, globally, we are still trying to understand what's the role variants would play in terms of the disease itself, and whether the vaccines that are available right now would be able to respond appropriately to the variants that are in circulation. So these things can impact how fast countries reach herd immunity, and it's a question that is still undergoing all kinds of scrutiny and review. But we know for sure that once we immunize people, and we immunize a substantive part of the population, let's say about 80%, that we will be able to reduce the spread of the infection. Many countries, what they have looked at is not trying to get to herd immunity immediately, but try to get back to some sense of normalcy, first of all. And the only way you can get to normalcy is as you immunize people. You can then open up different aspects of the society, ease restrictions and things like that. And then after you finish doing that, as you continue immunizing, you'll get to a point where we can then say we have achieved herd immunity, because you'll notice a dramatic reduction in the amount of cases that you have. So it's going to be a work in progress. I don't want to give some definitive timeline, because all of this is a very dynamic process and things can change, and therefore we'll continue to monitor, and our objective is to get vaccines into the country, immunize as many people as possible, so that we can ultimately reach that goal of herd immunity. There's some good news that is coming out. We have seen one of the first studies that was released yesterday with the Pfizer vaccine, where they did a study for children between 15 to 12, and those studies have shown that the vaccine is very effective in that age group, both at reducing infection and severity of disease. So they are now going to go to the FDA to get approval to reduce the age. So because the Pfizer vaccine was 16 years and above, and they're now going to try to reduce the age so that anybody 12 years and above would now be able to get the vaccine. So that's positive news. We'll see how that changes the dynamic. Obviously, it would allow us to be able to immunize at a lower age and capture more people into this population of the vaccinated. Once Pfizer has done that type of study, I'm sure the other vaccine manufacturers would also be looking at similar studies with their vaccines. So we expect over the next month or two that we'll be seeing more and more clinical trials, the results of clinical trials coming out pertaining to this younger age population.
All right, Minister, great news indeed. I have a final question for you, and it's because you mentioned the word ease restrictions, and it's something we have been speaking about repeatedly, but we can't ever stop right now, and that is we haven't eased restrictions in terms of the social distancing and so on. And I wanted to ask you specifically because we're going into a weekend where people tend to have a lot of events, and right now those are restricted.
Well, again, common sense is what we have to use. We know that this virus is transmitted, via droplets or aerosols. So if you're in an indoor environment, it would mean that the virus can be easily transmitted and stay suspended in the air for quite a period of time. And that is why people still have to wear their mask, and even if the person is familiar to you, but they go and come, they have their own friends, they have their own behavior, they can go and be at risk with somebody who has been COVID positive, and then they bring that into the work environment or the home, So we have to be conscious. We have to wear masks. We know that masks are effective at preventing the virus from spreading, and if you wear the mask, it's going to protect you. So I don't know how much more we have to emphasize this, but we still see a lot of people who are not wearing their mask, and that's an offense in this country. And you also have people who wear the mask but wear it incorrectly. It makes no sense, and it's going to be of no protective value if you have your mask on and you put it around your neck instead of covering your nose and covering your mouth. When we talk about wearing a mask, we mean that you must cover your nose and must cover your mouth. And if you do that, then you're protecting yourself. So we have to constantly emphasize this, and we need to change the culture where if someone see another person not wearing a mask, then they should, tell them to wear a mask. And if everybody start doing that, we'll have better compliance in the shops, in the businesses. If shop owners and business owners put up a little notice, you can do a handwritten notice, you can print it out, put it up there to say that anybody entering these premises must wear a mask. It makes a big difference, right? In the buses, the mini buses, people must have, the drivers or bus owners should put up little signs to remind people that when you're using public transportation, that they should wear a mask. So it doesn't hurt to put up a little sticker or something of the sort in the bus to remind people to wear a mask, because again, you're in a relatively closed environment. Let's say you're in a minibus, you're close to people, and if you're not wearing a mask and somebody in that bus happens to be positive, then, and you're not wearing a mask, then you can get infected. So all these things can be avoided. We can reduce spread if we do simple things. And if we do that, we are going to save lives. So I just want to make that appeal. The persons who are operating boats, it doesn't hurt to put up a little sign to say anybody coming to you, to travel on this boat, that apart from wearing your life jackets, that you must wear a mask as well. How much would it take to do that? It doesn't take much, but it can make a big difference, right? So we want to appeal to people to start abiding by the rules that we have and to ensure that they wear their mask in public all the time.
Yes, sir. Minister, thank you so much for speaking with us today.
Thank you.
Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.